8 screws, right? So let me again, it's not that you can't get an okay expansion with MSE, okay? You can see the patient is expanded, but the teeth are bent, right? The alveolus is bent outward, yes? We agree or disagree?
I agree to some degree. There's definitely some tipping at the molars.
Yeah. Okay, and it's going to reach a limit, right? And that, you know, you're going to tip it to a certain degree, and then okay. So what it does is that I'm not saying that you can't achieve a certain. This patient is, I don't know, 30 or something. Okay, so you can achieve it. I'm not saying that it's not impossible. It's possible in some patients, but is it predictable? No. I don't think so, because I see so many failures. Unless you show me, look, I've in all my lectures, I think I've demonstrated plenty 30-year-old, 40-year-old, 50-year-old, and 60-year-olds. Yes.
Mm-hmm.
So please don't show me 20-some early 30-year-olds. Please show me something a little more convincing.
Right.
Okay. So you can see how much.
You're saying, doctor, with age, that the bone doesn't sort of reach a certain level of rigidity where after age, let's say 30, it doesn't get any harder and stiffer than that. It just keeps getting stiffer.
It does. Oh, no. Look, everybody talks about age. Age is a major component of the stiffness. What I'm saying is that with MSE or Marpe or whatever that people are saying, it becomes harder and harder. So the cases that I see, okay, maybe they'll show a 30-year or whatever, that's a successful case, but show me something a little more challenging.
Why is a 30-year-old, why is a 60-year-old male harder than a 30-year-old male if the 30-year-old is fully fused?
Oh, no. The bone, look, the bone is much, it's the suture line is denser. It's harder to expand. That's the thing, is that, you know, I see all these successful MSE Marpe cases. Don't show me a 25, 28, 32-year-old woman. Don't show me a teenager or a 21-year-old man. Show me 40, 50, 60-year-old men or women or middle age. And don't show me one case. Show me many cases, because that's, you cannot compare the result of, look, I think MSE is great, apply properly. Like I said, I've done plenty of MSEs, okay? It depends on the patient. It depends on how you do the surgery, right? Yeah. So all these people say, oh, MSE works with 8 screws or what have you. You know, you could show successful results, but how many successful results and how predictable it is. And by the way, let me get back to the MSE and the screws. So you're going to expand to a certain degree, right? So why did this patient come to see me? Because his nasal breathing is only improved a little bit. By the way, he has empty nose syndrome, and he still has significant sleep apnea. He's very symptomatic.
Empty nose syndrome from the MSE?
No, from nasal surgery.
Okay.
So, you know, I mean, he's expanded, but could he have a better expansion?
That looks a little asymmetric to me as well.
Wow.
Looks like it's gone uphill on the left side.
Yeah. So could he have a better expansion? In my opinion, yes. He could have a better expansion. I'm not saying that MSE, custom Marpe, whatever you want you use, can get parallel posterior opening in some patients. Okay, that's not what I'm saying. I'm saying you have to look at expansion pattern, because at the end of the day, what are we trying to achieve? We're not trying to achieve an intermolar distance of 32.
Right.
That's not why he's coming to see me. I'm trying to improve this patient. Yes?
Correct.
Okay. We don't have to go through that. So, by the way, this patient is going to have MMA because he's very symptomatic. Okay. Of course. And by the way, you know, look, I know people, I'm sure I rub people the wrong way. Okay. What, when I decide to continue, and really I'm enjoying, at the end of the day, I want to enjoy practicing. Otherwise I will stop. If I'm not putting on a good product and I'm not enjoying my practice, I will stop that day. Okay.
Mm-hmm.
But the reason that I really want to continue is because why am I so outspoken about all this other stuff? Just like I think you're doing a service because there's so much junk out there. And I feel like it's my obligation to talk about all look, the people that are doing these things are not, that's not their intention, but they're so, you know, they're so false product, false
Sure.
promise. Okay.
Sure.
So
they don't know what they don't know.
They don't know what they know. They don't know what they don't know. Okay.
Yeah.
Now,
so here's the appliance in his mouth. So this is a custom Marpe, and you can see it's fairly anteriorly placed. It's in front of, well, it's
yeah. I mean, it's pretty typical. I've obviously there are variation of custom Marpe. Is what's the patient's age? What's the objective? What's the reason for the expansion? And was it just the device, or is it there are a lot of different sort of variables.
So I will tell you. So this is a male in his 30s, and he is doing this appliance because of persistent poor nasal breathing and sleep disordered breathing, sleep apnea.
How severe?
Very severe, very disabling. Primary feature of this young man's life is his sleep disordered breathing. Up to this point, he has been dancing around the issue, trying to essentially just survive. He's managed at this point to get himself engaged. He's going to be getting married soon. A big feature of his relationship with his fiance is that she understands how terrible his sleep disordered breathing is, and she is accepting of his journey to try to correct it. And this young man's primary purpose right now is to cure his sleep disordered breathing.
There's no such thing as cure. Okay.
Fair.
I remember people say, "Oh well, I saw someone, someone's friends or whatever that had ease, and they still need CPAP." I think you could sense that I'm never going to tell someone they're going to get off CPAP. They may very well be, but I'm not going to tell them. That's number one. Number two, there's no cure for sleep apnea. Everything that we do is kind of like curing high blood pressure. Okay, it's or curing aging. The goal is to improve.
Mm-hmm.
So if I assume that the patient has severe sleep apnea, AGI 30 or above, and what's his height and weight?
He's probably 5'9", 145, if I had to guess. Okay. He's a thin guy.
The probability of this device to even if it's successful in terms of expanding him, and we could debate on what successful expansion is. Even if this device is successful in expanding him, I will be very surprised that it's going to make a modest improvement in his sleep apnea.
Will it at least potentially improve his nasal breathing?
Depending on how the expansion
is. It's in his mouth.
Yeah.
Is it worth turning the appliance and giving it a shot?
Look, sure, he could give a shot. I mean, that's fine. I mean, I think he should probably, as he expands, he should probably, watch his bite and get some CT scan interval to see how he's expanding, and then how his symptoms are improving or not.
So when you see one of these relatively anteriorly placed appliances, does it scream out to you, oh man, this is going to do more harm than good? Or does it scream out to you, eh, underwhelming, but maybe still could help some?
It depending on what the practitioner told the patient.
Yeah.
If the practitioner told the patient that because I hear it, okay, that, oh, I was told that this is the treatment for my sleep apnea, I don't need CPAP. Then I said, you're wasting your time.
Just regardless of what the practitioner told him, just in a vacuum, is there given his situation, and I can tell you visually, he's very narrow, all around in his face, and that
Yeah.
he's, definitely could just benefit from some nasal volume expansion. Do you think this is going to do more harm than good because of the potential for conical expansion, or
Well,
or
look,
not?
conical expansion, again, it depends on the degree. Look, conical expansion is not like, I'm not saying that conical expansion is terrible, because conical expansion can still improve patients. But the expansion, can you get better result? The answer is, in my opinion, is yes.
Okay.
Okay. But on a 30-some-year-old, it depends on, is it just a device alone?
Yeah, no assist.
Good luck.
Okay. Worth a shot, but be careful.
I will be quite surprised if that he's able to open up his mid-palatal suture.
Mm-hmm. Mm-hmm. Okay. And your advice to him, if he decides to proceed, would just be keep an eye on the bite and have a scan done just to make sure that he's getting what he thinks he's getting in terms of expansion, rather than just tooth tipping and screw drag, etc.
Oh yeah, he's going to tip his teeth. It's just, I can guarantee you. Look,
Okay,
I don't want to sandbag whoever is doing this. Okay,
that's okay.
So but I think it's very unlikely, and that's the problem.
This is a European orthodontist, by the way, someone very far away.
Okay, and that's the problem, is that, just because you could do an MSc. By the way, I think MSc is great in terms of that we're able to expand teenagers successfully without any sort of release. Okay, it has it has advanced, but you're talking about a 30-some-year-old without any sort of release, just with this. Give me a break.
Okay.
And even if you're able to do it, it's what are you gonna? And you're gonna have your teeth tilted out significantly, and okay, maybe you're gonna widen your anterior. Even if you're able to split the suture, you're gonna widen it 1 millimeter. And I've seen people call it success.
Yeah.
Right. So
Yeah.
by all means, use this for teenagers. That's more applicable. It's all about case selection, right? And that's what
Understood.
I see with the FME. Oh, geez, the company that you don't need it released. You just do this because we have 3D, we lock screws, isn't that? Look, the anatomy doesn't change, right?
Yeah.
But
Okay.
sometimes some patients, they have thicker bone. Okay, you could get better, and there are patients you could get better engagement, and it could work, but it's uncommon.
All right, let's move on from that one, doctor. And thank you for opining. And that young man really wanted to hear your opinion because he's trying to make a decision. I don't know if what you said is going to influence him one way or the other, but
Oh, he'll give it a try. That's okay.
Yeah, give it a try. Is that your bottom line?
I'm not going to tell him to do what. I gave my opinion. I don't think it's going to be very successful. If he's going to try, just keep a close eye on it.
Okay. Thank you, doctor. That's incredibly helpful.